Controversial debate over circumcision in baby boys has been reignited. The procedure is no longer carried out routinely in Australian hospitals, but some experts want it reintroduced due to health reasons. Here's a look at both sides of the argument from last night's edition of Sunday Night.
What we're now seeing is a big rise in the number of uncircumcised males entering the sexually active community. Coupled with that, we're seeing a rise in all sorts of sexually transmitted infections and diseases.
Well, it's quackery. I mean, if you decide today that you don't want to have a nose because you fear that you're going to get cancer of the nose because you expose yourself to sunlight, you're going to remove your nose. There are safer options to prevent disease, not surgery. Safe sexual practices. Why can't we teach that?
Well, for more, we're joined by Sunrise Medical Editor Dr. John Darcy. Good morning to you.
Good morning.
So, is there sound medical evidence that we should be carrying out routine circumcision? This new research that's been done?
Well, in my view, absolutely not. Because I can remember 30 years ago when I started in medicine, the first patient I ever saw in accident emergency was a baby that was bleeding from a circumcision wound and nearly died because it had lost so much blood. Anybody who says to you that it's a simple procedure, just a little bit of cream, you go clip, clip, you know, let me tell you, it's mutilation and it's something that should be not reintroduced at all.
OK, but there's a bloke last night who does it that says, because most of my generation, we all got done, it was the common thing, didn't seem to do us any harm.
That you knew about. So one of the things, when I graduated, was the same. You know, everybody was done. And they used to say then, mother demands it, the doctor gets paid for it, and the baby doesn't have any say in it. Okay. And that was exactly what happened.
But this bloke who did one last night on the show, the baby didn't cry much, and he said things have moved on, there are sort of anaesthetic creams, it's, you know, it's pretty simple.
Well, it's not pretty simple. He's right in saying that there are anaesthetic creams. There wasn't in my day. You'd do 10 and the babies would be screaming all day afterwards. But now there is cream. But that's not the answer. You know, as the doctor said last night, improving sexual practices, you don't use surgery, the surgical condom, to improve the sexual practices of people in the community. You educate them, and where possible, you vaccinate them. Now, you take cervical cancer. The doctor said last night that you'll cut down the amount of cervical cancer by doing circumcision. Hey, listen, Gardasil, which is available for all girls now, is an immunisation which will cut down cervical cancer by 90%. If you give that same vaccination to boys, which is not done now, then you'll stop them getting penile warts. So that's a much better thing. Give them a shot. Put down the scalpel, doctor, and take up the needle, is what I say, because that's a much safer, better way to do it than cutting off the foreskin.
Well, some of the stats they've used in this new research, I understand now the Australasian College of Physicians is going to look at reconsidering its position on this because of the latest research. Do you think that will happen, and do you think the rates of it being done will change?
No. I think that it's good that they're renewing it, because you've got to renew and look at data every time it comes out. But putting it in perspective, what is appropriate in the jungles and the plains of AIDS-ridden Africa is not necessarily appropriate in a much more sophisticated world. Good that they're looking at it, but my guess is they'll come back and the status quo will remain, like it is at the Kids Hospital here in Sydney and right around the nation. They don't do elective circumcisions. They do them if there's a problem, and occasionally there is. They'll do them then, but they won't do elective circumcisions because you think it's a good idea, and they won't do them for religious reasons either.
OK. All right, Doc, thank you for your time.
Pleasure.